Are there any side effects to gynecomastia surgery? If so, what are they? How can we prevent them? I'm Dr. Aniketh Venkataram, plastic surgeon at Ava Aesthetics by Venkat Center, and today we will talk about what you can do to make sure that your gynecomastia surgery happens smoothly. Now, in any surgery anywhere in the body, there is always a possibility of side effects. Like it or not, that's just a fact. You can never be 100% certain that nothing will go wrong. What you can do is do everything possible to prevent that side effect from happening. So instead of there being a 10% chance of a side effect, if you do everything correctly, it will be less than 1% or maybe even 0.1%. That is what we can do with side effects. Now, what are some of the side effects after gynecomastia surgery? Well, the first one, and what we are most afraid of, and which is possible after any surgery anywhere in the body, is infection. Infection can happen after any surgery. The chance of it happening is very, very low, but it is not zero. At the Venkat Center, we have never had an infection after a gynecomastia, but we cannot say we never will have one. It's something like anytime you cross the road, you might be hit by a car. What do we do to prevent infection? We give the patient proper antibiotics. We make sure the surgery happens in a clean environment. The OT is fumigated properly. We take all aseptic precautions. All the instruments are properly sterilized. We don't just use an autoclave. We use what is known as ETO machine. That is a higher level of sterilization. The patient is painted and prepared properly. With all these things, you can take the maximum precaution and avoid the chance of any kind of side effect. The second possibility is something called a hematoma. Hematoma means with the area that you have operated, there is some bleeding that happens after surgery and some blood collects. This again can happen anywhere in the body after any surgery. But we do something that helps prevent this. We do our surgery under local anesthesia with something called tumescent anesthesia. What this means is we give a lot of anesthetic fluid with adrenaline, and this helps to close all the blood vessels. With this, the chance of a hematoma happening is very, very, very low. This is how at Ava Aesthetics we avoid the chance of a hematoma happening. Number 3 is something called a seroma. Seroma means when you do liposuction in any area, there is an empty space and fluid can collect in that space. This fluid collection can happen a week, 2 weeks, 3 weeks after surgery. This is not dangerous, but it can be irritating. It has to be repeatedly removed with a syringe. This is usually common after liposuction. But at Ava Aesthetics, this also we are able to avoid. How? Because we do the surgery under local anesthesia, we are able to make the patient stand up and then do our compression dressing in the standing up position. Because of this, we are able to squeeze all that fluid out and give good compression. This helps the skin to stick to the underlying layer after the surgery, and this helps avoid the chance of seroma. So our seroma incidence is much, much, much lower than what the published literature says. Number 4 side effect after surgery is scars. Now, this depends on how the surgery is done. Any surgery where a cut is made, a scar has to happen. But what we do is we do our best to prevent a large scar from happening. How do we do this? Firstly, we do not make any large cut around the nipple, nor do we make a large cut on the chest for severe gynecomastias. What we do is we make one small hole in the nipple, one small hole in the side, and through these tiny holes we do our surgery. How are we able to do this? We are able to do this because we have a machine called Body Tight, which is a skin tightening device. Through the same holes, we introduce this machine that heats the skin from inside, and this stimulates the skin to shrink and tighten. And because of this, we are able to avoid giving any kind of large cuts or marks on the patient. So this is how we are able to keep a very minimal scarring in our surgeries. The 5th side effect is altered sensation or numbness. This is common after surgery. It's because the nerves are disorganized. The bigger the gynecomastia, the more numbness there can be after surgery. This numbness is typically temporary and it comes back, but it might take 3 to 4 weeks to come back. So this is again something that is fairly common, but it is temporary and it is not something to be worried about. So these were the 5 common side effects. Now there is a 6th category, which is not a side effect, it is a poor result. This means that the surgery was not done well and the patient is not happy with the outcome of the surgery. There is no complication or side effect as such. This can be for two reasons. One is if you remove too much in the gynecomastia and you create a what is called a saucer deformity where the nipple goes inside. The second is where you don't do enough and you leave too much behind and there is some gynecomastia left over. Both of these aren't ideal situations. We are able to avoid this because since we're doing the surgery under local anesthesia, we can make the patient stand up in the middle of the surgery, see how it is looking, make them lie down, then do some more surgery. This way we're able to judge the result in real time and we're able to remove the right amount, not remove too much or too less. So as you can see, there are quite a few advantages to doing the surgery under local anesthesia. We're able to avoid various side effects. You can see our other videos on this topic to understand how the surgery is done under local anesthesia. If you want more information, do get in touch with us. Do like, share and subscribe this video. Thank you. Have a great day.